He went back home here in the States, and then 2 days later, he was gone.
I think I've had enough.
Hi guys, how's it going? Dr. Kyle here, and today's episode, I wanted to talk about blood clots. I was compelled to talk about this because one of my friends who traveled to the Philippines passed away because of a blood clot. He was only 37 years old. He was a nice guy, very fit, very healthy. It was a 17-hour plane ride. He was just sitting on a plane. He went back home here in the States, and then 2 days later, he was gone. Super healthy. He exercised. He did well with his diet, and he took the necessary medications. He was also he was in the medical field. He was a nurse. So going back to blood clots. Blood clots are, in very simple terms, it's your body's response to injury to help you. It's your body's response to injury to help stop the bleeding. Your blood has the capacity to form into a semi-solid substance, so the bleeding can stop. That's why some people who are more prone to clots, they take what you call anticoagulants or blood thinners. A common thing, I think, is aspirin, that's prescribed by your doctor, heparin, or warfarin. Those are one of the more common drugs that are prescribed to patients, especially after surgery or if you're in the hospital for prolonged periods. Your circulation is compromised. So what I tell my patients or my family members, if for example, if they need to take a long drive, first of all, what you do is you just get up and move. Get up and move every 1 to 2 hours, because that's automatically gonna help with your circulation. Your calf muscle here, your muscle right here, it's a one-way valve. Every time you walk, guys, like this, so if you step, every time you do this, you see that motion? That automatically pumps blood back to your heart, because your calf, not only does it make you walk, stand, jump, squat, I don't know, all these things that your calf does, it's also a one-way valve that promotes circulation back to your heart. So what I tell my family or my mom, my dad, if you guys go to the Philippines, you guys need to take a long drive, just get up and walk every 1 hour or two. That's exponentially really going to significantly reduce your risk of getting a blood clot. Number two, if you're sitting down, just go like this. These are called ankle pumps. So you do this, just pump your ankles. I would do that 50 times every hour. Just do that. That's all you need to do. 50 times every hour. That promotes circulation back to your heart. You have all these vessels that deliver blood back to your heart. Okay, every time you pump, it may look silly, but it automatically brings circulation back to your heart. I would also recommend, especially after surgery, after you're immobilized, if you're not moving for prolonged periods, I would highly recommend, that's what I tell all my patients, just pump your ankles, especially in the cardiac unit where we do physical therapy, in the ICU unit, when, post heart surgery, like a stent placement, we get up the patient, I have them walk, and then once they're back in their chair, I tell them, hey, Mr. So-and-so, just make sure you pump your ankles 50 times every hour. If you can't walk, just pump your ankles. Okay, if you can do it together, very easy. You can tell your mom, your dad, just keep pumping your ankles 50 times every hour. You can write your name, the alphabet. You can write your name with capital letters, smaller letters. Main point is just keep moving, because that's automatically going to promote circulation. And what you also could do, if you feel like you're going to have a long plane ride where you're going to be in a prolonged seated position, I would also recommend you to wear stockings. That's something you can ask your doctor. My grandma always wore stockings because that should help with the circulation. Just ask your doctor, hey doc, I really want to prevent blood clots when I go drive, or I have a long trip coming up. Is there any way that you can help me? Just ask for the stockings. What you can also do is you should also ask if your doctor can prescribe you blood thinners that should help reduce it makes your blood thinner so you're not prone to blood clots. So we talked about exercise, get up and moving 1 to 2 hours. Get up and move, go to the bathroom, drink your water so you're forced to go to the bathroom, do your ankle pumps. You can wear stockings, you can take medications, prophylactic treatments to reduce the risk of you getting a blood clot. Some signs you may having a blood clot is swelling of the legs, is because your circulation is compromised, or that clot, what's really also dangerous is that clot can form at the bottom of your leg, and then that can go up to your lungs or capillaries in your lungs, alveoli, that can get stuck here, can compromise your breathing, and you can't breathe anymore. You can have shortness of breath because if you can imagine, if this is your blood vessel, there's a tiny clot there that's impeding blood flow, you are going to be out of breath, which is one of the telltale signs that you may have a blood clot. Number two, there's tenderness. If you touch it, it can be tender, like, oh, it seems a little bit off. So if you touch your legs, that could be something off and it's more tender to the touch. That can also be a sign that that you may be having a blood clot. You can have increased pain in your lower leg or anywhere around your body and shortness of breath. Then your calf gets bigger and it can also turn blue because you don't have circulation. It turns blue, you're not getting enough oxygen in that area. You have pain in your legs, you have difficulty breathing because your lungs can't function properly. That's the worst case scenario that happened to my friend. He went home and after 2 days he just didn't wake up because he couldn't breathe anymore. The clot went to his lungs and he couldn't breathe. To recap everything, a blood clot is your blood becoming thick and it turns into tiny substances, solid particles that could impede circulation. It's a response to injury, for your body's way to help you to stop the bleeding. To prevent this from happening, move all the time, especially if you know you're going to be in a prolonged seated position, you're going to be in a flight, say to the Philippines, or you know you have surgery, post-op surgery, you had like a knee replacement or a hip replacement, or you know you're not gonna be moving as much. If you're not gonna be moving as much, your circulation is always compromised. So make sure, number one, you pump your ankles. If you don't plan on walking, if you're tired to walk, make sure you're pumping your ankles 50 times every hour. And then make sure you just get up and walk. If you're in an airplane, make sure you get up, walk, go to the bathroom, and just make sure you keep moving all the time. Number two, wear your stockings because that should help you reduce the risk of getting a blood clot. Number three, you can ask your doctor for any kind of medication that you could take to prevent the blood clots. These are called anticoagulants. What we do in the hospital is ultrasound. Yep, you get a Doppler ultrasound that you can see whether there's a clot or not. If you have any questions, shoot me a comment and I'll do my best to answer those questions. Salamat sa everyone that greeted me. Happy birthday. I really appreciate it. The bottom of my heart, thank you so much. I hope you're well. I miss Philippines a lot. And I've noticed that life is so, I don't know, man, it's fragile, anything can happen. And I just make sure that I'm grateful every day for everything that I have. I'm grateful for a house, food on the table, and just the little things, just it can happen anytime. Whatever your purpose is, just find that. Family, your job, your careers. Have gratitude. It really helped me a lot, just having gratitude and just appreciating what I have in front of me, no matter how small that is. Today, I just woke up in the morning and I was able to walk and I was able to shower and I was able to feel these things. I was able to go to the grocery store and buy food. That really made me happy. I'm just appreciative of that. Feel free to reach out if you have any questions. YouTube.com/Dr. Kyle, Instagram.com/Dr_Kyle.Yenko. Thank you very much for listening. I hope you all have a great day. Bacolod, I miss you. Philippines, take care. Bye. Peace.